Hello, my name is Catherine Hoare-Stout, and I will be discussing narcissistic personality disorder, and you will often hear me refer to it as NPD throughout this presentation. There are 10 personality disorders listed in the DSM-5 book. That includes paranoid, schizoid, antisocial, borderline, histrionic, narcissistic, avoidant, dependent, and anarchistic, known as obsessive-compulsive. A personality disorder is an enduring pattern of inner experience and a behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. Today I will focus on narcissistic personality disorder, which is a pattern of grandiosity, a need for admiration, and a lack of empathy. It was not until the 1980s that NPD was officially recognized in the DSM-3 book as an official personality disorder, although it's been around for much longer than that. The term narcissism originates from the Greek mythology story of Narcissus. It is a story about a man who one day caught a glimpse of his reflection in a pond, and he was so mesmerized he continued to just stare at himself until he faded away into a flower. That is where the flower Narcissus gets its name from today, that you will find growing along the banks of water. Otto Rank was the first psychoanalyst to cover the concept of narcissism in 1912. He described it as self-admiration and vanity. Freud then brought it up in 1940. He referred to it as primary narcissism in his article on narcissism and introduction. This is where he explains that it is a normal part of human psyche and a surviving skill for developing a sense of self. In 1967, Otto Kernberg introduced his theory of narcissistic personality structure. His theory included three major parts: normal adult narcissism, normal infantile narcissism, and pathological narcissism. In 1968, Heinz Kohut first used the term narcissistic personality disorder. In his theory, self-psychology, he suggests that narcissism allows people to suppress feelings of low self-esteem and develop a sense of self. All of these theories have led to the current diagnostic criteria that you would find in the DSM-5 book that clinicians use to help diagnose narcissistic personality disorder today. Narcissism may look different from person to person, and the characteristics will vary. A common behavior is extreme entitlement or narcissistic rage, which is a sudden, extreme anger. Behaviors to look for could include aggressiveness, which is contempt, argumentativeness, and verbal or physical confrontation; impaired relationships, dissatisfaction, infidelity, dislike from others; externalizing behavior, drug and alcohol use and process addiction; internalizing problems, depression, anxiety, suicide; and a general lack of insight into their own personalities. A common question is, what causes NPD? How did I get it? And an article titled "The Making of a Narcissist" by Lucia and Bessie discussed the etiology of NPD and that it is found in faulty parenting. The blame is to put on the caretaker's failure to provide optimal, frustrating experiences that are necessary to enable the child to develop a more realistic self-image. This theory cannot be applied to all situations and makes this argument weak. Much of this data was collected through self-report from patients diagnosed with NPD. Their perception of their upbringing may differ from the actual truth. There's not a whole lot of research on the prevalence, but one journal did say that there is a low prevalence for adult non-clinical patients, and this info was obtained by looking through medical records from January 1980 to August 2008. A study in Poland that included 1,460 men and women ranging from ages 18 to 65 determined that 7% of the population suffer from NPD. The onset of MPD is typically in adolescence but can be as early as childhood. Medical professionals and clinicians are reluctant to give that diagnosis to such young children because it is controversial. Although recognizing the characteristics and identifying the diagnosis early is very key in the successful treatment. It is difficult to narrow down an exact figure of the cost of MPD. Divorce, unemployment, addiction, legal fees, and medical expenses all contribute to the total cost to have MPD. A study recently reviewed insurance records, and it showed that patients with personality disorders accrue more medical expenses compared to those who do not. There are several different techniques of treatment that have been used and show success. One of the ways that I looked at is the collaborative therapeutic assessment. This has been very helpful for patients in inpatient facilities, and one of the benefits is that they have a whole treatment team working together for the treatment. This assessment is done in multi-steps. The first step is a clinical interview. The clinician's going to sit down with the patient, build a rapport, a good relationship, trust. Then the second stage is going to be a series of standardized testing. Not all of these tests may be done in one appointment and will be spread out. Some of the tests included would be the Minnesota Multifacet Personality Inventory 2 test, Million Clinical Multi-Axial Inventory 3 test, Thematic Perception test, and the Rorschach Performance Assessment System. The third stage will be they will collect all of the results of these tests, and the clinician will actually sit down with the patient and discuss the results with them. This process helps educate the patient about their diagnosis and lets them learn more about themselves. The patient also gets to be a part of the treatment planning and also to develop and create a plan for ongoing treatment after discharge. Another treatment that I looked into was metacognitive interpersonal therapy, MIT. This method focuses on the various narcissistic processes and creates a step-by-step process to confront them. The step-by-step process will create a regulation and ongoing of therapy to create a relationship to minimize ruptures, misunderstandings, and disengagements. MPD patients can be difficult to treat, but this method has been successful in many cases. MIT is completed in 2 phases with multi-steps within each phase. The first stage is referred to as stage setting, and the second stage is referred to as change promoting. After investigating both styles of therapy as treatment for MPD, I've realized that they are very similar. The first one is geared more for inpatient, but they do end with a plan for outpatient ongoing treatment. It would be interesting to see the results of how many of these patients followed through with going to outpatient treatment, but that info was not available. MIT was very similar, and both treatments worked in steps and also started with building a good rapport and relationship with the client. I did, however, prefer the MIT approach because I do like the change promoting phase, and I do believe that would be an important step of the process. The key to successful treatment for individuals who suffer from MPD is being able to get them to acknowledge that they have it and that they want to change their behaviors. It may be difficult or frustrating to work with these patients, and they often will attack the therapist, but it is important to not let them succeed, and that the clinician must have thick skin. It is natural to want to defend yourself or to give up, but it is important to stay consistent in the early stages of ongoing treatment. More common or not, these patients will have more than one diagnosis. Those other illnesses will have their own hurdles to overcome. Any other underlying disorder will need to be stable before starting the treatment of narcissistic personality disorder.